the protein is not being expressed in the biopsy, then that could be added diagnosis. What is difficult is that I'm not sure what the incidence of this is in the Indian population. There might be other mutations which might be present, which may not be identified, so you may send for it. So the clinical suspicion still remains paramount in establishing the diagnosis. We have got children who do not have genetic diagnosis but behave like PFIC type 1, and we treat them like PFIC type 1 on the basis of clinical suspicion.
Right, wonderful. So let us forget about this. We have last case, which is very interesting and more commonly seen. In fact, jaundice from day 10 of life, pigmented stool, poor feeding, seizures, stormy neonatal course, ventilated for pneumonia, day 4, day 8, later necrotizing enterocolitis, recovered. And so we have a child who has cholestasis, sick baby, pneumonia, history of seizures, diagnosis, audience. Pardon? Wonderful, very good. Very good. So this is the actually total protein, albumin 3.8, albumin is 2.8, prothrombin time, not correctable. Very difficult to correct. You can see all these features, sick child, cycleremia, skin bleeds, hypoglycemia, ascites cells. And then what do you see? What is the most likely diagnostic possibility? Dr. Shankararayan need not actually express because they have already expressed. They have done a wonderful job. What we are going to teach them, they are teaching us. So Ashish also need not to respond to this. And what investigations? This is all. USG will do, what is the confirmatory test? Can anybody say? Galactosemia. How would you screen in your clinic? How would you do it? Everything is here. Non-glucose reducing substance is 3+, although it may not be specific, but you can suspect. Galliput is low. And you can see blood culture, Klebsiella. That is why these children are sick. So any neonate with cholestasis, sick child, suspect galactosemia. I have also seen many sessions with AMs and PGI, neonatology, DMs. So they always treat sepsis, cholestasis. Look for galactosemia. Look for herpes infection. That might be causing liver failure in them. So they do pick up and they do very well actually, galactosemia. And you can see here, I want to just show you this slide. Follow-up, LFT normalized after 1 year. Coagulopathy corrected, organomegaly regressed, no major intercurrent illnesses, steady weight gain, normal development. Fantastic. Such a sick child, simple elimination of milk and supportive management has really brought him to life. So this you should always remember, these sick children should be quickly picked up. Since the time is over, Dr. Podar had one comment. Kindly make that comment. Okay, thank you. See, actually, whatever directions we have, we can't have the interruptions, then we will not be able to finish the panel discussion. I'm sorry for that. And, sir, we conclude. No. Otherwise, Abba will not call us next time. No, thank you very much.